Thanks for joining us on This Week in Health IT Influence. My name is Bill Russell, former healthcare CIO for a 16 hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Today we have BJ Moore joining us with Providence Health. He is the CIO amongst other things, and we always have interesting conversations, and I think you're going to get a lot out of this one as well. Special thanks to our Influence show sponsors, Sirius Healthcare and Health Lyrics, for choosing to invest in our mission to develop the next generation of health IT leaders. If you want to be a part of our mission, you can become a show sponsor as well. The first step is to send an email to partner@thisweekinhealthit.com. Hopefully you've heard our big announcement. We are introducing written content onto our site to accompany our existing 4 podcasts. I'm personally excited about this, and it really allows us to reach a different group of people than we've reached in the past. I hear stories about people who listen to our shows on their daily runs or their commute to work, if those things still exist. But I also know of professionals who would rather skim an article than listen to an hour-long podcast. So I'm excited to say, starting next week, we're going to be hosting news write-ups of our shows, as well as feature stories on thisweekhealth.com. And we want to hear from you. So please shoot us a note and tell us what you think. If you're excited, if you have questions, or even if you're interested in becoming a contributor. One of the things I am really excited about with this move is we opened up all new avenues to allow contributors to come in to the platform. So we're going to be able to share articles that you write. We're going to also be able to potentially have you host podcasts and submit them to the show so that we can put them out there to our community. And we are really excited about that. So thank you for listening and joining in our mission of raising up the next generation of health leaders by amplifying great thinking to propel healthcare forward. You know, somebody sent me a note and said, hey, how can we help out the podcast? There's 2 great ways you can help out the podcast. One is just shoot a note to a friend and tell them that you're getting a lot of benefit out of the show and that they should really subscribe to it. But another way you can really help us out is by, whatever app you're listening to the podcast on, go ahead and click and give us a review. Tell people about the value that you're getting from the show. We would really appreciate it. It helps us. It moves us up in the rankings in Apple and in Google and in the other services as well. And doesn't take that long, and we really appreciate it. And now on to today's show. So today we are joined by BJ Moore, the CIO for Providence, and much more. BJ, welcome back to the show.
Thanks, Bill. Always great to be here. Appreciate it.
Yeah, I'm looking forward to the conversation. Yeah, so you are more than a CIO these days. We were talking just prior to coming on the air that you've taken on some additional operational roles and capabilities. Talk a little bit about that, and then I'm going to come back and get into some of the questions I sent over.
Yeah, absolutely. So back in August, 2 changes happened. One, I now report directly to our CEO, Rod Hochman. So that's great, being part of the direct executive leadership team and deeply engaged with the board and our sponsors. So that elevation in the CIO role is kind of the holy grail for IT leaders. But in addition, I also took on the real estate and facilities for Providence. And so all of the hospitals and clinics and the operations of those now roll up into me as well. And the idea is there's synergies. The future isn't just IT and tech separate from real estate and facilities, right? Those lines are blurring more and more. And so, maybe that's something we can dive into now or dive into later here.
Yeah, it's interesting. You were the 3rd CIO I've spoken to this week who has taken on operational capabilities. Now, there's a whole host that have gone in the digital direction, have taken on digital roles, but the operational role really makes a lot of sense to me when I think about it. I mean, as a CIO, you have to understand and know things at such a deep level, and then digital really changes the way we view certain things, doesn't it?
Yeah, absolutely. And, as it relates to digital and facilities, right, it's 2 things. One, it's the workforce of the future, right? The planning people at a desk. I think those days are behind us. So it's really more of a melding of technology and working from home and those things. And then, COVID have proven the success of telehealth and remote patient, monitoring. And so that is tech enabled. And I guess the 3rd bucket would be, as we move to become more and more green, we've got a goal of being carbon negative by 2030. So smart buildings, how do we, do things in more of a green way? How do we leverage our facilities, with greater capacity? And a lot of that's going to be, through technology as well. So I'm excited. When I took over the role, I predicted if we were the first, there would be many other companies that follow, because I think those lines of digital versus physical are being blurred for sure.
Carbon negative. Well, that's the first. That's the first I heard that. That's a pretty aggressive goal.
It is. And as I've reminded, carbon neutral is a goal, and then if you can just be 1 unit negative, you're officially carbon negative. And so it's more aspirational, but it's not that much more aspirational than being carbon neutral.
Yeah, and you were sharing a story. We were talking earlier of just how being head of facilities, and someone says, "Hey, we need 1,000 more beds."
Yeah,
you really look at that very different than, "Hey, let's plow under some trees and let's put up another building."
Yeah, a year ago, 1,000 new beds would have immediately conjured up a new hospital, and a new hospital is a 5 to 10 year endeavor and $1 billion plus. And then, sticking with the green theme, it would be tearing down trees and building a new building. And obviously a lot of carbon goes into a building. COVID has proven care can be digital. And so I think when you talk about 1,000 beds, that may be physical, but really here at Providence, we think 1,000 beds can really be virtual, right? That care at home. So a real example, at one point in time, we had 1,000 COVID patients we sent home, and we were managing and monitoring them remotely. And for those patients, they receive fantastic care. And as an individual, if you weren't acutely ill and you had the choice of staying in a hospital bed or going home to your own bed, I think most of us would choose to go home and be in our own bed. Yeah. So in that case, they got great care. And from our perspective, it freed up a hospital bed for more acute patients that did require hospitalization. So simple example of how things are becoming more and more digital. And really, where at Providence, we're thinking digital beds as being the future.
Yeah, you guys really are leading the way in a lot of different areas. We had Amy on as well, your chief medical officer. She shared some just fantastic things that you're doing there. We talked to Matt from your digital team, and they produced some really interesting materials as well. I mean, you just have so many resources available to you that we are looking to organizations of your size, scale, scope to sort of lead the way and set the tone. But before we get there, I get in trouble all the time because my listeners have asked me to start each show by asking the guests to tell a little bit about their health system. So tell us a little bit about Providence.
So Providence is one of the largest health systems here in the United States. We've got 120,000 caregivers. We do about $25 billion in revenue, and we serve basically the Western United States. So we're here in 7 states. During COVID, we received the first COVID patient in the United States on January 20th that came into our Everett hospital. And I'm happy to say we successfully cared for and cured that individual. And so, as it relates to COVID, Providence was at the forefront, receiving the first patient. So that's a quick background on Providence. I could go on and on.
Yeah, we could go on for a while, but let's, I don't usually do this, but I can go in so many different directions with you. What are 2 or 3 things that you want to make sure we talk about today that you're excited about, that you're working on?
We touched a little bit upon it. We're in this COVID world, but what's been important to us is how do we obviously serve our communities and respond to the pandemic, but how do we continue with our strategic bets, right? We couldn't it wasn't binary. It wasn't do one or the other. It was continue our strategic bets while responding to the pandemic. And then the other one is how do we evolve healthcare? How do we, there's been some positives that have come out of COVID, like telehealth, like virtual care, like, care delivery at home. How do we maintain those gains and accelerate it? And so those are 2 topics near and dear to my heart, and be good to cover those.
And one of the things I loved about working at St. Joe's, which is now a part of Providence, was the presence of the sisters. And so, especially at a time like this, there's limited vaccine, no matter what market we go to. right? So there's that challenge of
Yep.
taking that constrained resource and distributing it effectively. You want to vaccinate as many people as possible.
Yep.
But I try to communicate this to people. It just the sisters would be there and say, always, what are we doing for the marginalized? What are we doing for the disenfranchised? What are we doing for? And they would always bring the conversation back there. So it was always top of mind at a health. So talk about that experience a little bit.
Yeah, I mean, that's different from coming from Microsoft. That's one of the things that attracted me to Providence is that mission, and that mission is to serve our underserved community, the poor and vulnerable. And so, yeah, the sisters are always that driving force, right? You sometimes get involved in internal politics or administration or back office things, and the sisters are always there to remind you, hey, it's not only about the patients, but it's about our underserved communities and what are we doing to, bring them to the forefront. And COVID was no different. How do we have these emerging technologies like telehealth and make sure we're including these, poor and vulnerable communities and not creating a digital divide? And so they're always our social conscious, and they're always there to remind us, why we're here and what our purpose is.
All right, let's head down. So some of this are the topics that you've given me. Some of them are things I'm reading. So you did the significant Microsoft deal. I think it was a 10-year deal. Is that correct?
It was a 5-year deal.
Yep. All right. So you've already been outdone because Kaiser did a 10-year deal with Microsoft.
Yep. I don't know if that's a better thing or a worse thing.
I don't.
5 years feels like a good horizon. So long enough to get things done, but you're not locked in for a decade.
Right. Exactly. A decade's a long time in the technology world. You have to be careful with 10-year bets. Why was that important for Providence, the Microsoft deal?
Well, I mean, it came at a time. So we signed in July 2019. And, it served us well for two main reasons. One, on the collaboration side of things. So we fully embraced Microsoft 365. We were on an 18-month journey. We were about halfway through that when COVID hit. And we accelerated that. And so Teams, that whole collaborative environment proved invaluable as we sent all of our caregivers home. So boy, if we hadn't done that, I can only imagine where we would have been as a health system. The hodgepodge of solutions we had just wouldn't have worked. So we, obviously we didn't know the pandemic was coming, but that paid off. More strategically, how it paid off is, during the pandemic, if you remember early on, PPE, ventilators, were really in short supply. We didn't know if we'd have enough ICU beds, and so projecting surges were invaluable. We were about halfway through our journey moving our on-premise data to the cloud, Azure's data lake. And because we had that data there and accelerated in COVID, we were able to use machine learning and artificial intelligence to predict where we needed more PPE, where we needed ventilators, where the ICU surges. And we reached the point by probably May or June that we were able to predict with about 85% accuracy 2 weeks ahead where things were going to be. Okay, we're anticipating in 2 weeks, things are going to get better here in the Northwest. We think in 2 weeks, things are going to surge in Southern California. And so with that insight, we were able to move resources and assets and these, precious items like PPE around to serve those communities. And so that was a strategic bet that proved invaluable. So I'd say Microsoft 365 and then the ML AI models that we were able to do for COVID.
Yeah, so the stack gives you so many more capabilities than you would have had on a traditional healthcare stack.
Yeah, I mean, all of the innovation is happening in the cloud, whether it's healthcare or traditional companies, like an ERP or a CRM vendor. Everybody is doing the innovation in the cloud. And so if we hadn't moved to the cloud, embraced the cloud, these advanced compute capabilities just wouldn't have been there. If we were, all of our data was locked on premise, we would have been, stuck with traditional analytic models versus, machine learning and AI really only can be done at scale, and that can only be done in the cloud.
Will that end up being your IoT platform for hospital at home and those kinds of initiatives?
Yeah, absolutely. The scale that we need, the volume of data that we need. When we talk about big data, when I arrived here, our data warehouse was about 70 terabytes, and we would call that big data, but at 70 terabytes, that's just not big data, right? Big data is measured in petabytes or exabytes, and you're not going to have exabytes of storage on premise. And so, yeah, when you talk about IoT and streaming, activity and heart rate and all these things, yeah, it'll all be into the cloud. And then when you're talking about that volume of information, human beings aren't going to be able to run a query and say, hey, how's Bill Russell doing today? It looks like his temperature spiking, right? It's going to be a machine learning or AI bot that's monitoring your health and giving out instructions or actions for nurses or caregivers to respond.
So your, if I'm hearing this correctly, that platform is going to be real time. It's going to be an operational data store as well as analysis data store as well.
Yeah, I mean, it's got to be, so we're in Epic shop. So our Epic data will be in Azure Data Lake, and we'll have, some latency on patient information. But as it relates to IoT and streaming, that's got to be real time. And then the monitoring of that has got to be real time. So use my example of the 1,000 COVID patients we sent home. The timing, we didn't have IoT set up. This is where we're going, right? You would have a temperature monitor on you, and if your temperature changed, you'd want some bot monitoring your temp real time and alerting a nurse, right? It's only valuable if it's real time. It can't be, hey, yesterday at noon, Bill Russell's temperature spiked at 102, and the doctor's like, oh, I wish I would have known. I would have intervened, right? As soon as you get that IoT signal, it would reach out to a caregiver and say, hey, Bill's temperatures changed, set up a telehealth, ping them, see if there's some intervention we need to take.
I think that some people have this misnomer that we're not going to be able to do high transactional kinds of things in the cloud, but the reality is
it's the only place that can be done.
Yeah, I mean, if you're going to do the AI and the machine learning stacks are going to be in the big players for the most part.
I mean, you look at what Google does or Facebook does or any social media platform, right? They're getting telemetry from all their users interacting with the platform real time, and their algorithms and models are responding to that. So it's that precedence already exists, right? They're working with exabytes of data and in near real time able to respond to that. So that compute capability that's used, for good or bad in social platforms can be used for good in health systems. And it's the only place, we can do that level of scale. And as you know, burnout for our caregivers is one of the biggest issues. The last thing I can do is ask a caregiver, oh, by the way, every hour run a query to see how Bill Russell's doing. Like, it just aren't going to have the time to do it. So we're going to have these proactive models that monitor and then alert in real time to take action. So,
every now and then I get an email from one of my old employees, which are now your employees.
Oh, no. Don't tell me any bad news, Bill. Only tell me the good news.
No, but I understand you're finally taking the St. Joe's Marketplace to Epic. So that's a Meditech shop, and you're going to take all those sites over to Epic. Is it? I mean, what's the thought process behind it? Just to finally get everything on the same platform?
Yeah, I mean, it's been the vision, right? Like I said, we're primarily an Epic shop. Epic's a good EHR. As you know, St. Joe's is on Meditech and Allscripts and old versions of those platforms, not even the modern version. So yeah, in the spring, we'll bring our Southern California ministries and clinics on Epic, Northern California in October, and then March of next year we'll bring Texas on, and we'll have all 51 hospitals, all 1,000 clinics, all on Epic. To the best of my knowledge, we'll be the largest Epic single instance in the world. And yeah, just having all of our patients and caregivers on a single EHR just makes sense.
So you have to walk and chew gum. We're moving to the cloud. We're doing machine learning AI. We're setting up IoT, hospital at home. And oh, by the way, we still have to make sure that these internal systems are, current.
Yeah,
and
you got to have an anchor, right? And the anchor for our electronic health records will be Epic. And so having that single source of the truth then allows us to hang off the IoT data, the streaming data, the big data that we get. Otherwise, you're putting hodgepodge on top of hodgepodge. I'm not sure what that would look like, but
Now, just for clarity, when you say Epic is your anchor, you mean like your grounding, not anchor like weighing you down, kind of thing, right? I just want to be clear.
Yes. Epic is a good partner with ours, so I don't want to be disparaging.
No,
Anchor it does a good job of capturing core electronic health record data, but back to my 70 terabyte information, like 70 terabytes may be Epic data, but an exabyte's going to be image data, DNA, IoT, streaming, and that won't be an Epic. That'll be all adjacent sitting in the cloud.
Yeah. No, I just want to be clear, because my team will pull out like quotes for social media. And when they pull out the quote that says Epic is our anchor, and they attribute it to you, I want to make sure they put it in the right context when they hear that. So, let's talk about you talked about, strategic bets and those kinds of things. Yep. And obviously one of the strategic bets is here, but I saw some business things as well. So you guys have either spun out, I'm not sure I got this right, but essentially you've taken capabilities you had internal, you spun them into a different organization, and now they're delivering services not only for you, but externally as well. Is that close?
Yeah, you mentioned earlier the sisters and making sure we're serving those underserved communities. I'm happy to say, last year we delivered almost $2 billion in services, free health services to those poor and vulnerable communities. And the only way that can happen is by us being healthy financially. And so, we look at businesses like a service business that has higher margins. How do we have aspirations to build $1 billion service business that's called Tegria. And so, we had various assets like Blue Tree. We pull that, put under that for-profit company. That for-profit company rolls into Providence. And that goal is to grow that into $1 billion services business. And then the profitability that we get from that helps, fund our overall operations and helps us get back to the community.
Yeah, and
you got that right.
Yeah, so it's Epic go lives and implementations. You also had a Meditech shop as well. Yep. So serving some of those rural
We're starting to look at rev cycle services. How do we optimize our own rev cycle services? But is that a BPO service that we can provide to other health systems as well? So we're looking multifaceted.
So that has its own CEO, and you now deal with them as sort of a vendor at this point?
Providence, as you know, is a complex system. I think we've got 200 legal entities. I would think of it as just another legal entity. And so they're on our corporate network and on our Microsoft 365. So I don't see that we're not really a vendor to them. You're right. They're really just, we provide shared services to them like everybody else. The professional services they provide to IT, or my organization, certainly is more of a vendor relationship where they'll come in and we'll pay for those services. But the goal is for them to sell services to other health systems. That's how we generate, free cash flow and really bring profitability to Providence versus left pocket, right pocket. More services they do for me, we're just moving cash around the same entity.
Right. And they've really been doing this for years. I mean,
they have been.
Yeah.
So it's nice to have a brand, or, you can refer to, and it's easier to say, hey, here's Tegria, potentially this $1 billion services business versus, referring to the sub brands.
So let's talk about working with the innovation team. You guys have one of the more well-known innovation teams in the healthcare space. And as I said, we had Matt on the show, talked to Sarah and Aaron and everyone over there over the years. They have a stable of companies and initiatives they're working on. You have an IT operation that you need to run. How do the two come together? I mean, they have a portfolio of companies that aren't necessarily Providence companies.
Correct.
How do you work with them on that?
Yeah. So Aaron Martin is a peer of mine. I think of him as the consumer facing or patient front door. So anything that's marketing, website, patient engagement, patient scheduling is kind of that front office component Aaron and his team does. as it integrates into things like Epic, and then obviously the core IS infrastructure my team owns. And so there's pretty clear lines of division there. Overall, the partnership is good. You know, they do invest in companies. What's also super interesting is they'll incubate companies like Zelt, you know, where we'll be their first and best customer, and then they'll get spun out to be a separate entity. And so we're also adopters of those. You know, use Zelt as an example. They're one of the partners we used during the COVID crisis to do some really compelling things. So overall, yeah, it's you know, like any partnership, there can be tension, but overall, it's a strong partnership, and the lines of division are pretty clean and clear.
Yeah, you know, it's interesting to me just to ask the question, and I'm not digging for anything. I'm more curious because all these innovation arms are very distinct. Like if I went, I mean, yours and maybe Jefferson's looked similar, and maybe UPMC looks similar. But if I go down to Cedars, it looks a little different, and if I go over to they're all a little different, and some of the CIOs will say, you know, I sort of feel a little pressure here, and or I've had to give away some of this that I would really like to have, and so anyway, I'm more asking the question out of curiosity of how.
Yeah, I would look on the other side of the coin. As you know, as an IT leader, we're encumbered with a lot of technical debt and baggage. And so if you've got an innovation team that needs to deal with network availability and outages and cyber and technical debt moving to the cloud, it's tough to prioritize. Do we do this cool new innovative thing, or I got a cyber attack going on, and you know, you're going to do cyber. And so innovation takes a back seat. So by separating us and saying, hey, Aaron, you get to work on innovation where BJ's stuck dealing with cyber attacks, it creates this nice division where Aaron, you know, knows I have his back, and I'm working on a cyber attack, and so I can take care of that. And it really frees his team up to focus on innovation. To wear both hats. Innovation is always going to get the short end of the stick, and I don't think you innovate in the way that you can if they're separate.
Yeah, and I love their approach. I love the fact that they're talking to the consumer, they're getting feedback. I love the different their approach to it is really exceptional, and I've seen that at other systems. I've seen Jefferson bring in consumer and patient groups as
and every
well.
model has its pros and cons, right? If there was an obvious right answer, everybody would be doing it the same way. So it depends on the maturity of the org, the goals, the objectives they're trying to achieve, how much technical debt they do or don't have. A number of factors.
Well, I'll spare you a conversation around tech debt. I can only imagine how much tech debt you guys have just from sheer size. You just have to have a fair amount.
Yeah.
You and I talked cloud, and we talked follow the sun support in our first interview, and I'd love to get an update on how that's going.
Yeah, so you know, U.S. health systems by definition are 24/7 operations, but being in the U.S., you end up, what I found when I came into healthcare, we're trying to staff it with U.S.-based workforce. So, you know, a year ago, we had the foresight to set up a Providence team in India. It was our first international company at Providence. So they're sitting in Hyderabad. One of the things they're doing is that 24/7 coverage, network operations, cyber operations. And it's fantastic. Yeah, hospitals are 24/7 operations, but there's less activity 3 a.m. in the US than, 7 o'clock, on a Friday evening when, maybe the ER is getting full. So having that 24/7 coverage is not only helpful, but allows you to do some impactful things, in off hours where it minimizes the impact of operations.
So have you expanded that then? Are they doing patches? Are they doing that kind of work?
Yeah. And I don't want to minimize the team. So we're up to 300 caregivers now in India. 24/7 coverage is one of them. But, the other reason we added that team there is I didn't have a strong engineering muscle. So we're building an engineering team there. We're doing a lot of healthcare analytics and business intelligence in India. It wasn't an outsource strategy. So we didn't take a function we were doing here in the US and move it to India. We really filled in the gaps that we weren't doing and couldn't afford to do. So as we had attrition here in the US, I took that instead of backfilling it in the US, I used that to fund these roles in India. But yeah, 24/7 coverage. It's engineering. Some of our services business we'll do out of India. So that'll give us more scale from a service delivery perspective. And it's not just an IS asset, right? It's a Providence asset. So we may do BPO work. We may do legal counsel work there. We could do a number of things in India.
Yeah, that's amazing. 300 people over there. So
yeah, and hired all those people during a pandemic, right? In January of 2020, I had one person, and I got an update from the team just yesterday, and we've hired our 300th person there in India.
Wow, that's amazing, and that does take care of that. I mean, India is almost the exact
it is
opposite from a time frame.
Here on the West Coast, depending on daylight savings is 12 and a half hours time zone difference.
Yeah. So did you have to fly over there last year, or did you forego that last year?
I did. I flew over there. I've always had teams in India, so I love going to India and visiting the teams. My last trip was just as the pandemic was starting. I went over there late February of 2020.
Wow.
And get back there.
We haven't spoken in a while. I do want to sort of get your take on this. And I realize now you've been here for a couple of years. You've been in healthcare for a couple of years, and you know what you can and can't say. The thing I appreciated about your first interview is I don't think you knew what you can or couldn't say, and you were kind of freewheeling it. It was kind of fun. But what has been the most rewarding thing about coming into healthcare from literally decades in high tech?
Yeah, the most rewarding is crystal clear what the mission is of Providence, right? Giving back to our community, serving our patients, serving the poor and vulnerable. So having that connection to mission is, super rewarding. The fact that healthcare is so far behind, I estimated, I think in our first interview, and it proved to be accurate, we were about 15 or 20 years behind. And so accelerating the digital transformation, having that impact, getting the feedback from patients and caregivers. I've received more, love emails, my last 2 years than I, probably 27 years at Microsoft. And so I feel like I have a real impact and really making a difference. So I think, the both are exciting.
Can you move
a difference and a difference that counts?
Can you move as fast as you did at Microsoft?
We are moving much faster. So I think when I first talked to you, I can't remember if I shared in the interview, but certainly was in the back of my head. My fear was the reason healthcare was 15 or 20 years behind is because they were change adverse, that it would be difficult to deliver that much change. I can easily say in 2020, in that 12-month period during COVID, during a pandemic, we delivered more in that 12 months than I probably ever saw Microsoft deliver in 3 or 4 years.
Wow.
And not only did we deliver more change in 12 months than I ever saw Microsoft adopt, but there was less pushback. There was less noise. We moved a lot of cheese all at once by necessity because of the pandemic, right? Sending people home, adopting teams, new password policy, 2-factor auth, new cyber policies. Like there was a 3-month period where we were making changes every day, and people were just rolling with it and adopting it, and they really, really were troopers. So yeah, I would say the opposite, Bill. I wouldn't have thought 2 years later I would have said this, but I can look you in the eyes and say, yeah, in 1 year, in 2020, we delivered more than Microsoft ever did in 3 or 4 years.
Well, great. So you guys aren't 15 years behind anymore. So
no, and if in a year from now, not only will we not be 15 or 20 years behind, we'll be caught up or even ahead of others, right? A year from now, we'll be on a single instance of Epic. We'll be on Oracle Cloud, so we'll have a single ERP, single HR system, single supply chain system in the cloud, right? How many $25 billion companies can say they are on an ERP cloud solution, a single one, end to end? We may be the only ones of this scale. So yeah, we're catching up and passing people, which is exciting.
So this was part of your story coming in. You had taken this organization within Microsoft and you had taken the entire thing to the cloud. Do you still suspect that you're going to be able to do that pretty much across the board in healthcare?
Yeah. Obviously, there's workloads that need to stay in a hospital or ministry. Can't afford internet outages. Given the criticality, but from a volume and cost perspective, about 98%, we'll say 95+% we'll be able to move to the cloud successfully. The other thing that's been a gift in moving to the cloud is kind of like the house that you lived in for 30 years, the things in the attic and garage you thought you needed until you moved and you decided you didn't really need that stuff.
Yeah.
We're retiring 50 to 60% of the applications. We are determining, what, that's not being used anymore, or we can consolidate that, or we can archive that. So we're, as we move out of data centers, and we've now moved out of 2 of our 6 data centers, we've retired 60% of the apps in those data centers.
That's amazing. Well, and I'm also looking at this Iris Foundation for Epic. And, if I'm reading this correctly, I mean, it's essentially a modern stack. So they're able to really re-architect the entire Epic platform. You could actually see at least DR go into the cloud, if not full-blown production of that.
Yeah, I mean, the partnership with Epic and Microsoft has been good on this front. Our existing Epic instances actually could move to Azure now, and we're in the month of March, we'll have 2 instances, 2 of our legacy instances of Epic, well, 1 legacy and 1 DR environment in Azure. The reason we don't move our production instance to Azure is, as you pointed out earlier, when we move St. Joseph to Epic, it'll go from being able to fit on Azure to being too big. But we think we're 12 to 18 months away where the virtual machines on Azure will be big enough. We'll be able to move our Epic instances there, both primary as well as DR.
If you can share, what's been the biggest challenge or the thing that you didn't expect that has been a struggle?
As it relates to moving Epic or just overall?
Oh, no, moving into the CIO role, moving into healthcare.
It's the tech debt. I mean, it's across the board. It's everything from our PBX, our networks, local area networks, our wireless, number of applications. We have 4,000 applications here at Providence. Microsoft, $1 trillion company doing business in 200 countries, only had 1,000 applications.
Right.
And so that's been the challenge. How do you keep the day-to-day operations running? How do you simplify that environment? How do you retire and migrate folks off of legacy systems and still innovate? That's been by far the biggest challenge.
Yeah, and I don't think and I gave some of this to you. I mean, we had a hospital that was on a 20-some-odd-year-old PBX, and we were buying.
That was one of the more modern ones, Bill.
Yeah. Well, we were buying parts off of eBay to keep that thing running, and people are like, "Really? That's a hospital system you're keeping running that way?" It's like, yeah, I can't explain it, but there's just so much tech that you have to bite it in chunks. You can't take it all on.
And those things like PBXs that just work until they don't were easily forgotten, right? And so you tell executive management you've got a 20-year-old PBX, and they're like, I haven't had a single phone issue. Like, why should I worry about it? But you and I know you're one motherboard failure away from that whole thing coming down. And if you can't find that motherboard on eBay, right, for a 20-year-old PBX, like, what does that mean? So,
yeah. Well,
so obviously we need to take care of those things, and it's important when we are. But as you take care of that 20-year-old PBX system, you're not, doing IoT and big data because you just don't have the bandwidth to do both.
Right. And I like how you separated all that up. It's one of those where you say, okay, the company that provides your PBX is called Nortel. Go find them on the internet.
Exactly. Yeah, you hire young and career kids, and they're like, what's this Nortel thing you're talking about? Yeah, it doesn't exist.
So, hey, BJ, it's always great to catch up with you. Thanks for coming on. Do you guys have these backgrounds provided to you? Because Amy Compton Phillips also came on. She had a very nice Providence background as well.
Yep, it's something my team and the branding team partnered on. So we have it here in WebEx or in Zoom, and we also have them for Teams. And so, yeah, why not? We've got the backgrounds that come with those great tools, but why not have a Providence branding go with it as well?
Oh, absolutely. One time I asked somebody, I'm like, what's really behind there? They took it off and he was actually in his garage. He's like, it's the only quiet place in the house. He goes, but with the background, you don't know I'm in the garage. I'm like, yeah, I understand.
Well, I'm at work right now, but I'm social distancing. Nobody else is here, so I have the office to myself.
Well, hey, again, I appreciate it. Thanks for coming on the show. What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. Perhaps your team, your staff. I know if I were a CIO today, I would have every one of my team members listening to this show. It's conference level value every week. They can subscribe on our website, thisweekhealth.com, or they can go wherever you listen to podcasts, Apple, Google, Overcast, which is what I use, Spotify, Stitcher, you name it, we're out there. They can find us. Go ahead, subscribe today, send a note to someone, and have them subscribe as well. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, Starbridge Advisors, Aruba, and McAfee. Thanks for listening. That's all for now.